Don't you hate it when you sign up for something and then you find out that it's changed right after you signed up for it, especially if you're stuck on that plan for a solid year? Hi, my name is 𝗲𝗂 𝗟𝗏. I work with all things Medicare, and today I'm going to bring you a story from Kaiser, the foundation that does research into public policy and Medicare. This is a story that is something we hear continually over and over again, something that we as agents that help people with things have no control over. But it is not just you that's being affected. If you thought, I signed up for a drug plan, then things changed like right away, it's not just you. It's happening everywhere. I want to share the story with you. Again, this is from Kaiser Family Foundation and this research. The study says drug plan prices touted during the Medicare open enrollment, which is actually the annual enrollment period, can rise within a month. Read you part of the story. Something strange happened between the time Linda Griffith signed up for a new Medicare prescription drug plan during last fall's enrollment period, and when she tried to fill her first prescription in January. She picked a Humana drug plan for its low prices with help from her longtime insurance agent and Medicare's Plan Finder, an online pricing tool for comparing a dizzying array of options. But instead of the $70 she expected to pay for her dextroamphetamine, so it's basically Adderall, used to treat attention deficit hyperactivity disorder, her pharmacist told her she owed $275. That's a pretty stark difference. I didn't pick it up because I thought something was wrong, said Griffith, 73, a retired construction company accountant who lives in Northern California. To me, when you purchase a plan, you have an implied contract, she said. I say, I will pay the premium for this plan on time, and they're going to make sure I get the drug for a certain amount. It often doesn't work that way. As early as 3 weeks after Medicare's drug enrollment period ends, December 7th, Pearl Harbor Day and my birthday, insurance plans can change what they charge members for drugs. Isn't that convenient? And they do it repeatedly. Griffith's prescription out-of-pocket cost has varied each month, and through March, she's already paid $433 more than she expected to. A recent analysis by AARP, which is lobbying, this is the nonprofit version of it. I'll get that over there. Recent analysis by AARP, which is lobbying Congress to pass legislation to control drug prices, compared drug makers' list prices between the end of December and shortly after the December 7th sign-up date to again in January, just a month after the Medicare drug plans began. Researchers found that the list of 75 brand name drugs most frequently purchased by Medicare beneficiaries had risen as much as 8%. Medicare officials acknowledge that Medicare's prices and the out-of-pocket costs charged by insurers can fluctuate. Quote, your plan may raise the copayment or coinsurance you pay for a particular drug when the manufacturer raises their price or when a plan starts to offer a generic form of that drug, says Medicare.gov. No matter how high the prices go, most plan members can't switch to cheaper plans after January 1. That's right. That's why they have the one period of time every year that you have to do everything, said Fred Riccardi, president of Medicare Rights Center, which helps seniors across Medicare benefits. Drug manufacturers usually change the list price for drugs in January and occasionally again in July. Quote, but they can increase prices more often, said Stacy, an associate professor of health policy at Vanderbilt. That's true of any health insurance policy, not just Medicare drug plans. Like a car's sticker price, a drug list price is the starting point for negotiation of discounts, in this case between insurers and their pharmacy benefit managers. If the list price goes up, the amount the plan member goes up too. The discounts that insurers and their pharmacy benefits managers receive don't typically translate into lower prices. That's what the Trump administration had tried to pass on, was those discounts. Instead, these savings are used to reduce premiums or slow premium growth for all beneficiaries. And then she said, we constantly hear from people who are just having absolute sticker shock when they see not only the full cost of the drug, but their cost sharing part of it. The potential for surprises is growing. More insurers have eliminated copayments. Set a dollar amount for the prescription. Instead, they're going to a percentage of the drug price, said Chiquita Brooks, the top official at CMS. The drug benefit is designed to give insurers flexibility to make such changes. And that is one of the reasons why, quote, we're asking Congress to give us authority to negotiate drug prices, she said. CMS is also looking at ways to make drugs more affordable without waiting for Congress to act. Quote, we're always trying to consider where it makes sense to be able to allow people to change plans. So she's trying to do an end run around the AEP, which is great. And they announced some proposals going to help some low-income people. The article finishes by saying, when CMS approves plans to be sold to beneficiaries, the only part of the drug pricing it is approving is the cost-sharing amount, or the tier, applied to each drug. Some plans have as many as 6 tiers. In addition to tier pricing, what patients can pay also depends on the pharmacy, which we'll talk about as ways to save money here in just a minute, their deductible, their co-payment and co-insurance, and whether they opt to abandon their insurance and pay cash. Hint, hint. After poor Linda Griffith left the pharmacy without her medication, she spent a week making phone calls to her drug plan and the pharmacy and Social Security and Medicare, but could not find out why the cost was so high. Quote, I finally just had to give in and pay it because I need the meds. I can't function without them. But she didn't give up. She appealed to her insurance company, which was Humana, for a tier reduction. They denied it. The plan denied 2 more requests for price adjustment, despite assistance from Pam Smith, program manager for Health Insurance Counseling and Advocacy Program in California. They're now appealing directly to Medicare. It's important for us to work with the members who have questions about any out-of-pocket costs that are higher than a member would expect, they said. Oh, that was the Humana spokesperson said. She could not comment about Griffith's situation because of privacy rules. However, right after this story, Griffith received a call from a Humana executive. Humana said that they had received an inquiry from the media. After they discussed the problem, Griffith said, the woman told her that the Medicare Plan Finder tool is an outside source and therefore not reliable information, but assured Griffith that she would find out where the Plan Finder information had come from. She won't have to look far, the article says. CMS requires insurers to update their prices with Medicare every 2 weeks. That's where the information came from. Griffith said, I want my money back, and I want to be charged the amount I agreed to pay for the drug. I think this needs to be fixed because other people are going to feel cheated. That's the truth. So we're going to go over some ways you can save money on Medicare drug prices. A lot of people are so fixated on the plan that they got that they think that they must go through that plan every time, and that's just not true. But even if you do want to go just through your drug plan, there are some things that you can do to lower your costs. First of all, how much income do you make? How many assets do you have? If you've got less than, for a married couple, $30,000 worth of assets, not counting your car, not counting your home, not counting your personal possessions or life insurance, and your income is low enough, you may qualify for extra help. Extra help is going to definitely help you on your prescription drugs. You can either call Social Security and go through that. You can find out what those options are for you, or you can go online and you can apply yourself at Social Security online, or you could go into your local office and find out if that's just one option for you. If your income is low enough, they'll actually pass you on to the state program as well, and you can get help from your state as well as the federal government for lowering your prescription drugs. Let's just say that's not an option for you. Have you tried paying cash at the counter? Have you tried using one of the discount cards that are available, even at the counter and many times? Have you talked to your pharmacist and said, look, if I paid cash for this, or are you aware on this particular drug, are there any other savings programs that I can take advantage of instead of just using my Part D drug card? You may be very, very surprised to find out, oh yeah, why didn't you say so? You're paying cash for that? We find that all the time in our employer type insurance plans through the business. If I tell them, look, can I use this card or pay cash? Which one is better? Is there any discounts that you're aware of? Very, very often we are finding as a family, and many of our clients are finding that if they do this, they can save a lot more money. And as a matter of fact, in doing that, if you want to search at different places like Costco, the big box stores, especially if you're doing generic drugs, you may find that their cash price is better than any other discount program or your drug plan itself, for sure. You can try a 90-day supply. Many of the companies out there will give you a discount if you have a 90-day supply and then have it shipped to your house. You'll have to get, of course, a prescription from your doctor that says you can have 90 days at once, which is kind of hard to do when you're talking about amphetamines or narcotics for sure. But if it works for you, 90-day supply might help. Just look into it and ask a question. Is there a generic available? Many of my senior clients will tell me that they don't want to use the generic because they simply don't trust it. This is a conversation you should have with your doctor and maybe your pharmacist too about the particular drug in question. If it's the same exact result that you're going to get from it, and many people have the placebo effect. They'll start taking the generic and they'll think, well, it doesn't look the same, so it's not going to affect me the same. Again, it should be research that's done with your doctor in consultation, maybe with your pharmacist, to see how equivalent is the generic versus the name brand, and that could save you a small fortune. For instance, in this example, Lipitor retails for $400 almost for a 30-day supply, but the generic, which pretty much everybody's taking, is only $10. That's a huge difference for somebody on a fixed income. So if you're not already doing it, look at your drug list, see if there is a generic available. And again, this happens when those drugs come off of patent, when they're branded, when they're just a brand version available. So if you have not looked in a couple of years and you're still taking the drug from years ago, see if today there is a generic available. Here's an example on literally the drug that she was taking here. This is the Adderall. If she's taking a generic version of Adderall, 30-day supply, even at the maximum dose. I looked this up on Costco just a minute ago. She could get that same drug for $15.79 just by simply taking that prescription down to Costco and getting the generic version of it. Even the extended release of that drug is available as generic. And we know plenty of people who are taking the generic version of that specific drug and having no problems with it at all. Again, it's depending on you and your situation. I'm well aware of that. Another option that many seniors do, I know my mom does, get a twice as big pill on the bigger dose and then get a pill splitter and chop that thing in half. You can save a lot of money by doing that, but you can't do it with extended release or slow release medication like metformin extended release and so forth. But you can try that with a pill splitter. That's been a famous thing that people have done for a long time. Use a preferred pharmacy. Many people don't know that when they sign up for a Part D drug plan, or even a Medicare Advantage plan that has the Part D component built in, there are certain pharmacies with these companies that they have better relationships than others. Some will gravitate toward Walgreens, for instance. Some actually do Walmart, and some do CVS, especially like the Aetna program that actually owns CVS, or CVS owns Aetna. So you need to look at the preferred pharmacy, and I understand that you don't want to go into a pharmacy and stand in a long line. Many people have quite an aversion to standing in the long line at Walmart, for instance, but they get the cheapest drugs that way. So if that's the case, then you can not only look into the preferred pharmacy, but also the 90-day benefit and having that shipped to your house if you're going to be over on it for a long period of time. But many people don't know that since they picked Susie Q's pharmacy right down the road from them in small town USA, that by simply taking that same drug and calling around to the different pharmacies, CVS, Walgreens, Walmart, Costco, they may find that there's a drastic difference in the price of that drug. If you've not yet done that with your plan and do it every year, I highly encourage you to look at the different pharmacy. This was shocking to me. Health Payer Intelligence had a recent article that said 85% of seniors never shopped their drug plan last year. Just didn't even look at it. 85%. So let me remind you, drug plans are just like Medicare Advantage plans. They're under the same umbrella. And that means that they can change, and they do change every single year. Your formulary might resemble nothing from what the formulary was last year if you just count on that to roll into the new year. You should pay very close attention to your annual notice of change, your ANOC letter that you should receive in September, talking about the changes for your new plan. Pay close attention to that, and make sure that you look at the new plans with a fresh eye every year. Highly recommend it for your list of drugs. Just look at all the plans out there, because the other plans might gravitate more toward your list of drugs, making it a unique recommendation for you, as opposed to the old plan that last year was the best plan for you. We really have to shop this to be a good steward of our money, especially if you're on a fixed income. If you have the time, take half of a day, put the drugs in the computer for the new year, or if you're new to Medicare, definitely do this, and look for yourselves. See what the total out-of-pocket cost is going to be using your pharmacy. And in our drug tool, our drug lookup tool, you can change the pharmacy and see what the differences would be. Does one plan now outshine the other with cost because you changed the pharmacy? Something you should look at. 2 tools I want to give you where you can use this. One is our website with the plans that we really like dealing with, startpartd.com, kind of catchy, isn't it? At startpartd.com, you can put in your drugs, you can put in your pharmacy, and you can see the plans side by side based on total out-of-pocket dollars. That includes the deductible, if any. It includes your copay. It includes your co-insurance, the tiers, and everything as it's specific for you. And the other one that you can go to, some people think it's great, some people can't stand it because it's confusing, is Medicare.gov. One of these tools will definitely be able to help you to look at the vast array of choices out there and make a selection. Now remember, you can change drug plans, as is the current law, has always been since 2006 now. October 15th through December 7th, you can pick a new drug plan. That's the same window that you could pick a Medicare Advantage plan. Again, they're tied that way. One period of the year that you can get into a new plan. Now that does not become effective until January 1 of the next year. So you have to wait until October 15th through December 7th, anytime during that period. And I'll tell you, every year our office gets slammed with literally hundreds and hundreds and hundreds of calls on October 15th, everybody thinking that they need help with their drug plan or their Advantage plan on October 15th. But the reality is there's no advantage to you, no pun intended, to get it done on October 15th or December 6th. It's all the same. It's not going to start until January 1 of the new year. So we can kind of pace ourselves as we're getting into the Medicare season. And as always, I'll keep you up to date on all the changes, all the options and things that you should be looking out for every single year when this period hits us. So those are some tools you can use. This is an article that said, it just came out, Medicare beneficiaries need more help in navigating the program. That article says it is very, very confusing. We want to take that confusion away from you, whether it's regarding your Medicare supplement, your Medigap, your Medicare Advantage plan, or your Part D drug plan. You don't have to do this stuff alone. Just please don't stay idly by and watch your drug costs go up and up and up without you taking some action at least every year. But also look at those pharmacies, see if there's a generic version available, shop around with your plan that you have, see if another pharmacy is giving you a preferred pharmacy discount for that plan. You can call that plan's customer service and say, who near me is a preferred pharmacy if you're not already experiencing that? And then think outside the box. Ask your pharmacist, the person checking you out, is there a discount that I could use for this plan, for this one drug that I'm getting, or these 2 drugs? And what happens if I pay for that drug, the expensive one, out of pocket? How does that affect my overall bill? You may be surprised when you ask outside of the box of just, here's my card, what do I owe? You have to be accountable for your own best interest. If you have nobody out there that's your healthcare advocate standing with you at the counter, it really will behoove you to ask questions and see, how can I get this drug cheaper because it just costs too much money. My name is Christopher Westphal, and I hope this has been of some value to you. If it is, please hit the like button and share this information. If you're not yet subscribed, I highly encourage you to, so we can share other good content as things develop with Medicare. God bless you. Thanks for watching. Bye-bye.